In his opening speech at the 22nd Annual General Assembly of the Ethiopian Pharmaceuticals and Medical Supplies Manufacturers Association, Ethiopian Industry Minister MELAKU ALEBEL noted that the manufacturing sector has seen remarkable transformation over the past 7 years. MELAKU in particular highlighted Ethiopia's growing ability to produce medicines and medical equipment, contributing to meaningful sectorial progress. According to him, the reform era has created a conducive environment with significant improvements in infrastructure such as electricity and road networks.
The
pharmaceutical and medical supplies manufacturing sector has received significant attention in recent years, leading to remarkable transformation over the past 7 years. The sector has seen a substantial increase in production capacity alongside notable improvements in its share of the local market.
Ethiopian Health State Minister Dereje Duguma reinforced the government's commitment to local production and utilization of medicines and healthcare supplies. He said the government recognized the importance of accelerating innovation and scaling up production not only to meet domestic demand, but also as a platform to export beyond Ethiopia's borders. Local production has grown from under 10% to over 45% in the last 3 years to 4 years, elevating the sector's market size to more than 4 billion birr, the minister added.
Following the national reform, the health sector has been given due attention, recognizing that health is both a goal of prosperity and a key driver of it. A healthy population is essential for achieving sustainable development and national progress. Among these sectors poised to benefit most from the legacy of prosperity is the health sector. Notably, after 31 years, the full national health policy has been revised to benefit current needs and future aspirations. In line with this, we are actively working toward our vision of making Ethiopia a leading center for health tourism in the region.
World Bank Program Leader for Human Development in Ethiopia and neighboring countries, Sharon Varke, emphasized that the local pharmaceutical industry is pivotal to achieving health security and sovereignty. Local pharmaceutical manufacturing could generate nearly 50,000 additional jobs across Ethiopia over the next decade under the best case scenario.
So the local pharmaceutical industry fits in both these areas, and that is why we are so deeply involved. Of course, we have a social reason for it as well. Our agenda of 1.5 billion by 2030, that is to help 1.5 billion additional people to receive universal healthcare coverage by 2030. That is only possible if the private sector is involved. That is only possible if countries establish their own health security and sovereignty.
Africa CDC local manufacturing coordinator Abebe Gennetu also praised Ethiopia's efforts as a model for the continent. He further pointed out the importance of strengthening Africa's healthcare supply chain and manufacturing capacity to improve health outcomes and create employment opportunities for youth.
Africa CDC wants to approach it end-to-end, from research and development to supporting workforce development, all the way through technology transfer, input material supply chain, financing, and at the end, market. Through these 7 enablers, and at the center of it is coordination and convening. Through these enablers, we hope that we will localize manufacturing on the continent, and by 2040, we will be able to produce 60% of the pharmaceuticals, vaccines, diagnostics, and medical devices that we need in Africa will be manufactured in Africa.
The 22nd Annual General Assembly of the Ethiopian Pharmaceuticals and Medical Supplies Manufacturers Association was held under the theme Turning Milestone into Momentum, Unleashing Ethiopia's Health Products Manufacturing Potential for Africa and Beyond. During the assembly, participants discussed challenges such as quality assurance, workforce development, technology bottlenecks, and the need to strengthen human resource capacity.